Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Today we're joined by Ray Solano from PD Labs. He's also a nutritionist. Thank you for joining us today, Ray.
Well, thanks for having me today.
So could you tell us a bit of background about yourself?
Well, and again, thanks for having us today because we're really dedicated into getting out the word on personalized medications that are available, that how it really changes people's lives. We have a specialty pharmacy located in Cedar Park, Texas. That's north of Austin, Texas. Excuse me. And we focus on being able to help people with mold and Lyme conditions and also autism, the community, and be able to get this special medications in the right dose for them. We have a full-size clinic, the lifestyle medicine clinic as well, to really be able to help people learn their nutrition balance as well. And we're located licensed in 48 states and soon to be able to, in a brand new facility here in Cedar Park, about a 7,500 square foot building that will be able to grow with the community to be able to service them, because personalized medicine is going to be here to stay.
Mm-hmm. Wonderful. So what got you into pharmacy?
Fortunately, I've been involved in pharmacy since the early 70s to be able to really be able to take medicine to a different level. I have a background in nuclear pharmacy, very advanced technology at the time, and found my way back into compounding pharmacy over about 25 years ago, and realized that traditional medications are just not going to be able to serve people the way they're supposed to. They have to be personalized, different forms, different dosage forms, different routes of administration. Used to do a lot of sterile compounding at one time. It's so important for people to get better as opposed to just take 15 or 16 different medications a day. Can you believe that? Some people still do that many medications. It's just so, this is the reason why we started to being able to do this. We've recently expanded. We've merged with Hopkinton Drug, who's really been one of the leaders in low-dose naltrexone for years. And we merged our companies together and being able to give first-class service and quality to all the patients nationwide.
Mm-hmm. And you were saying about people taking 16 drugs. I've known many people who start off with, 2 or 3, and then they would take the 4th one. And of course, every drug carries, if you look inside, a list of potential side effects. Now, you probably never get any, or you might get 1 or 2 of these side effects. But when you start putting a cocktail of medication together, the chances of getting a side effect become higher. So I know many people who have, say, taken 4 or 5, and then they have to take another medication to combat the side effects.
The side effects of the other one.
Yeah,
that's
right. And then as it grows, and then they're taking like 7 or 8, they might have to take another medication because they've got more side effects. And it's really not helpful for the patient to continue down this route. And not only that, they still don't get the wellness they're looking for, are they?
And actually, they get worse. Unfortunately, their core metabolism becomes nutrient deficient. Their core levels of metabolic rate decreases. They gain a number of weight and their self-image goes down, and you'll find out that their ability and energy level decreases. So unfortunately, we have a shell of a person usually, and unfortunately, but the worst part about it is there's no end in sight. And so this is why many times we get to the root cause of the problem, and this is many times what we're finding in especially low dose naltrexone is a good starting point, because then they can start to corral some of the problems and get people off of some of these medications, especially where what this has done for the pain community and the chronic alcohol community. It's just amazing when we start to unravel all of these chronic conditions of how we start with this therapy, and we're able to really change people's lives.
Definitely. And to help people wean off of the opioids is a really big thing. What doses do you go down to?
Well, we go down to as low as we've done 1 microgram uh, dosage, where we used to be a sterile pharmacy, so we're used to be able to do microdosing. We do a lot of vasoactive intestinal peptide as well. So we're used in micrograms, oxytocins as well. So aliquots, low doses, are something we're familiar with. But one of the things that we have done that's kind of unique is being able to take these doses and be able to make this special tablet. And the pharmaceutical industry uses these ingredients, they call it cyclodextrans, to be able to enhance absorptions through the cell walls of these for these pharmaceuticals. Take these large molecules and be able to give them a little bit of an accelerator for the body to absorb them. And so we use these beta cyclodextrans and we make them into special tablets, so that patients could be able to change the dosage for themselves, being able to get to the drug, we get the right amount of drug and have the least amount of side effects. Many times when people do low dose naltrexone, they start in one dosage form, in a capsule form, usually sometimes 0.25 milligrams or a 0.1 milligram. And then they have to meter their way up, tighter their way up, and then they have to get another prescription. And then they have to get a different strength. So this is a way that people can take a half of a tablet and get started, and then be able to use the full dose 3-4 weeks from now. So it ends up being less expensive for the patient. It's a special technology. Making tablets is a specialty in itself, and we feel that for doing it for the last 10 years, we were able to really make a difference in getting the best therapy tablet for patients.
Mm-hmm. Do you do a sublingual LDN?
We can do sublingual drops. We've been doing that for patients, especially the children that like to be able, and some of our seniors, being able to master all these dosage forms for patients is something that specialty pharmacies are able to offer for patients. But sublingual tablets, sublingual drops are something that is very important for many people.
Exactly. I'm Dr. Jill Smith. I'm trying to think of the year. I can't remember, but she found with her Crohn's patients, by taking sublingual, which was absorbed bypassing the stomach, was more effective for those patients. But as you say, there are other patients now that are choosing sublingual. We find that sublingual is more expensive here in the UK. I don't know whether different dosage forms at your pharmacy are more expensive than others.
We are specialists in these sublingual tablets. We've been doing oxytocin sublingual for many years, and being able to use these tablet forms and to be able to change up the bases that are absorbed, special ones, sublingually is very easy to do, and it's not really more expensive at all, not that I have seen. So it's just really what giving the practitioner what they're looking for the patients. We look at that triangle, that partnership that occurs. So being able to make sublingual tablets, we think sublingual routes and nasal sprays are just a great way to bypass the stomach because many of these patients are having very difficult time absorbing. That's why we use these special tablets. They get absorbed sometimes much better than capsules.
Mhm. And do you find the nasal spray helps with dry eye?
That's we haven't seen very much of that, but we definitely think that nasal sprayers have, since many times they either pass the blood-brain barrier with special additives, they get absorbed so much faster. Unfortunately, we haven't seen a huge increase of that here in the U.S. yet, but I think sometimes we're just playing catch up to everyone else.
Well, that's something that we're going to be promoting because there are so many patients who would like the LDN eye drops, but because they have to be made in a sterile facility, they have to be made per patient. There's not really a shelf life on them.
Probably
It it
expensive too.
it makes, yes, the unit price exorbitantly expensive. So I have been told, I've yet to find out myself, and I've not ever tried any LDN nasal spray, and I suffer with dry eye, that the nasal spray possibly for dry eye could work as well as the eye drops because it goes up the canal. I don't know.
Well, we've made low dose naltrexone nasal spray in combination with ginsenoside R3. It's a special neuroregenerative compound to stop the combination of the two for brain inflammation. We've done a combination of those and actually launched that about 2 years ago. So we have the experience to be able to do LDN nasal sprays. It's a very stable compound. It's very easy to work with. It has good dating for patients, so it's something that they can be able to put in the refrigerator and be able to hold on to it for many months. So it makes it economical as well. That's important because
Wow.
sometimes these medications can get quite expensive.
Yes. So what would the shelf life be on nasal spray if you kept it in the refrigerator?
Well, many of the regulatory requires studies to be able to give these dating, but we have found at least 30 days is a minimum. We're looking at expanding that to 90 days stability. It's something that we're looking forward to. One of the things I didn't mention is the topical form of low dose naltrexone for many different dermatological conditions. For eczema and psoriasis is a perfect additive of oral and topical as well. So again, it's very stable. It's ends up the special basis is really important to get to the right with the right pharmacy that understands the correct technology of being able to get penetration through that dermis skin layer. That's something we've really worked on extensively and had tremendous results.
Mhm. I have spoken to dermatologists and pharmacists who compound LDN in topical as well as the capsules or tablets.
Mhm.
And some doctors use both in conjunction with each other.
Yes.
And some conditions they prefer that people just take oral. Um, the doctors that you deal with, what would you say is the most common for dermatological?
Well, we have a special relationship with our practitioners. It's a collaborative practice. We look at the patient, what's best for them. We look on a case by case basis, and they ask our opinion, what's the best choice for patients. Many times, by the time they come to us, these people are severely conditions that have been ignored by so many years. So we'd like to be able to be aggressive at first. So we recommend a combination therapy initially because it seems that they can turn it around much quicker as well.
Mhm. I've found speaking to patients who take it for, let's say, psoriasis, alopecia, Brecht syndrome, Haley-Haley's disease, to name a few,
Hmm.
that the dermatological conditions take longer to respond than autoimmune conditions, as in Crohn's disease or MS, chronic fatigue. It it seems as though it needs to get into the system for quite a few months. It can take sometimes 6 months. I've found people have told me before they have reverse of symptoms. Have you found?
Well, it's really important to be able to have the technology to get past the dermis layers. Uh, PD Labs has really started his patented process for the use of transdermal verapamil for Peyronie's and plantar fibromatosis and Dupuytren's contracture, all the same fibrotic tissue disorders. And we've really been able to perfect the absorption across many different layers of subcutaneous tissue to be able to get localized absorption at the source. And so we've been able to take LDN and put it with transdermal verapamil for Dupuytren's. We find it to be it's almost incredibly how fast it works. So it's important to get the right condition to have the right special base that gets absorbed and penetrates. And there's a number of different products out there that have special qualities that can get very quick absorption. So it's really important. So you don't want people to suffer. You want them to be able to get quick absorption. Unfortunately, many of these special bases can be a little bit pricey because they're very proprietary and they're very unique. But you're pushing the limits of transdermal absorption that is almost rivals the in many cases the fast blood levels like an injection. But to be able to get people turned around quickly, we find that these patients do so much better with being able to target that area very quickly, because you don't want them to suffer for 6 months at a time.
Mm-hmm. So if somebody had alopecia, would they have to rub the preparation on their scalp as well as taking oral?
That's
Or
what we recommend. We use a combination therapy because we're able to get blood levels quicker, because all these topical conditions are usually linked to gut dysbiosis and many other conditions that ultimately is able to express themselves as a skin condition. So any type of skin condition, we're looking to repairing gut first. We have a number of different peptides that are used to be able to repair the gut as well. So once we are able to do that, the skin heals so much faster, and that's why it's so important to do both.
okay, I was just wondering, if you rubbing something in your hair which makes it greasy, that makes you want to wash your hair more.
No, it
You
doesn't
know,
have to be greasy.
okay.
There's must very cosmetically appealing lotions that we do a lot with patients with hair, with many times for replacement of hair that have to be pleasant. They don't have to be oily. They have to be somewhat moisturizing to the skin, not drying the scalp. But you can be able to get at that absorption and have that smooth cosmetic feel, because nobody's going to want to put on something that their hair looks like greasy. So it's just a non-starter, especially women. There's no way we're going to be able to tell them that your hair is going to look greasy. They just won't do it.
Well, that's what I was thinking, because then you'd want to wash your hair, which would be pointless of putting it on if
That's
you're
right.
then going to wash it off.
No,
Exactly.
there's ways to do it, and it's really important to when you partner with a pharmacy, they have a can-do attitude and be able to have a big tool chest, and that's what we look at is what is the tools that we have available, and we feel we got a pretty big tool chest because we've been doing this for quite a long period of time. We got a number of consultants that work for us, and we've got a number of patented medications under our corporate umbrella, and so we're very fortunate that we keep on digging until we can find a solution.
So being a nutritionist, do PD labs make their own supplements?
Due to regulatory compliance, we don't really make them ourselves. We design them and
Okay.
have we have a special dietary supplement manufacturer, strategic partner that will fulfill and make those to our custom specifications. Many times we're able legally to put a prescription drug with some of these nutritionals so they can combine them together. That's many times what we do is take nutritionals and combine them with specialty FDA approved drugs to be able to solve many of these conditions. And many times we find things like traumatic brain injuries and stroke and many of these patients that we're able to target medications using this type of therapy. So it's really important to look at the whole body and look at the whole patient because they didn't get sick overnight and they didn't get, it's going to take some time to get them well, but we put a little sprinkle a little fertilizer at the same time.
So when you make your tablets or do you do capsules as
We
well?
do capsules, we
Yeah.
do lots of
So
capsules, and
are you
whatever they're
able
looking for.
are you able to put nutritional supplements in those to the if the patient wants ginger, for example, which I know some people have, or magnesium or whatever, are you able to do that for them or advise them which you think is the best
We do.
substitute?
We've got a lot of requests for items that people feel that they are having a reaction to the fillers. And many times what we find is that the body is having this overexpression of histamine. Okay. And many times this overexpression of histamine is due to a metabolic imbalance that is occurring because the body's this mesenchymal immune system is just offline. So if we can turn those systems back on, then their histamine levels or responses are normalized. It's sometimes not the small little uh, filler that's in the capsules, it's the whole body's over amount of histamine. So we're just sometimes really careful, because the absorption of ginger, let's say we put ginger in with LDN, do we know how much LDN is getting absorbed? Or maybe that the problem is, and I've learned from your lectures, that if the dose is too high, then they're going to get some of those same side effects. And maybe the dose needs to be decreased so that we can really modulate those side effects. And we find many people sometimes feel it's almost a sign of defeat that they have to go backward in the dosing. But I find, after listening to many of your lectures, it's usually the dose is too high.
Well, that's the thing. As you said at the beginning, personalized medicine, it's what dose suits that person. Some people have it in their mind 4.5, I've got to get to 4.5.
Right.
And they will say, oh, I did so well on 2.5. And then I went to 3 and didn't feel quite so good. And now I feel terrible. I think I'm going to have to stop taking it because it doesn't work for me.
That's right.
You know, so if 2.5 you felt wonderful, that was probably the right dose for you. Go back and see how you feel on 2.5. It's not that you're giving in. It's not a case of you failed to reach the 4.5. You celebrate the fact that you found the dose that works for you.
That's exactly right. And we found that many times people are taking capsules and when they switch over to tablet, they say, "Oh, I felt so much better on the tablets," or sometimes they say, "I feel worse with the tablets from the capsules." I said, "Well, what we found many people get much more positive effects at 1.5 milligrams and 2 milligrams as opposed to 4.5 milligrams." So I think sometimes there's kind of a bell curve that sometimes the 4.5 milligram is something that is not really the standard. It should be maybe 1.5 milligram. It should be maybe more of a standard because we want the body to have just as much drug as it needs. Low dose sometimes is better than higher dose. That's what we found.
Mm-hmm. So we've come to the end. It was really interesting talking to you. So can you tell people how can they get in touch with you?
It's very easy. We've got a very robust website, PD Labs. That's Paul David Ives, pdlabsrx.com. And you'll find a huge amount of information on LDN and all the other specialty pharmaceuticals that we do. And we've got our podcast and also our TV spots. We make it very easy for people. Our phone number is 888-909-0110. That's 888-909-0110. And we're in the continental U.S. right now. We're looking to see how we can do this internationally. But as you well know, there's a number of customs hoops we have to go through. But guess what? We're not giving up on it.
Ray? Well, thank you very much for being our guest today.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.